Dr. Peter Chin Hong joins us now from San Francisco. He's a professor of medicine and an infectious disease specialist at the University of California, San Francisco. Peter, there's always an abundance of depressing news when it comes to the COVID-19, but the news on the vaccine side has been fairly positive. Talk to us about this latest vaccine research and what we're learning.
Yeah, so I think, Mike, I think the recent research in China with vaccines comes on two fronts. First of all, the optimistic news that even though you may not prevent all infections from getting Chinese vaccines like Sinopharm or Sinovac, you prevent a high proportion of severe cases and certainly deaths. So I think that goes in line with what we've been seeing with other vaccines and no different there. The other set of vaccine research in China is going around making new kinds of vaccines. So I think I personally was very pleased to know that China was working on an mRNA vaccine as well, both Sinopharm as well as a smaller company called Walvax. In fact, Walvax has already conducted phase 1 and 2 trials and are planning to do phase 3 in Mexico and Indonesia. So I think why that's good is because you can customize probably an mRNA vaccine better than a protein vaccine.
And can you talk to us a little bit about China's vaccination rate? How's the country doing in those efforts, would you say?
Spectacularly. They've kind of put the rest of the world to shame, to tell you the truth. Almost 70% of Chinese residents are now fully vaccinated, compared to, about 50% in the US, about 60% in the UK. So again, when illustrating that you can try to get as many people vaccinated as possible, if there's a national strategy.
And we've heard so much, at least early on in the pandemic, about herd immunity. We got to get to herd immunity. When you start looking at numbers like that, where are we in terms of herd immunity in China, do you think?
I think it's still going to be very challenging with Delta. As you know, China is very, very, very strict contact tracing. And even with that, weren't able to prevent, Delta from setting up shop, even with travel restrictions, from, Nanjing going along to 13 provinces, but now down to no local disease transmission, hoping that will occur. But I think as long as you open the borders, and I'm worried about the Winter Olympics and, not being able to really control movement as well there. And the example in other countries like Singapore, which has abandoned that zero tolerance for infection, Australia, which is reevaluating its strategy, New Zealand, which hasn't really been as successful either, even though they're trying to, it may be a situation where we really, including China, have to live with the virus instead of under the virus.
Peter, I've made a few trips to China in recent years, haven't made any in quite a while, and I know there's a lot of other people kind of chomping at the bit. They'd like to get back over to China, and people from China over to the U.S. So talk to us about travel restrictions between these two countries. Where do you see those at this point, and when do you think those might ease?
So China has one of the most draconian travel restrictions in the world, and it's probably why China hasn't seen a lot of new infections. Even though the US is 1/4 of the size of China, you're talking about 130,000 new infections a day here versus a few dozen, and not many of, if any of them locally, transmitted. So it comes at a cost, and the cost is really the economy, although one would argue that China was the only economy to grow in the last year. But one would wonder whether or not you can keep that up. Right now, to travel from the US to China, you need to quarantine for 2 weeks, supervised in the US. Then when you go to China, 2 weeks there, getting swabbed, no spouses, no children, no tourism, no short-term business visitors. So again, it's just a matter of the long haul and whether or not travel restrictions, which are pegged to get better after the Winter Olympics in February, would need to be seen.
Yeah. Well, Peter, always a pleasure talking to you. Thank you so much for your insights. Really appreciate it.
Thanks so much, Mike.
Leaving the big city